Hi, good morning. I am Dr. Sandeep. I am a general and laparoscopic surgeon. I have an experience of more than 10 years. I have worked in India, worked in Maharashtra and in Kerala, and right now I'm working in UAE. This video will tell the basic things about surgery cases, like from small case to the major case. So the topic which I selected today is a case of a swelling. So as you know, we have different swellings in our body. Means we can get different swellings in our body. Like first thing I would like to tell you is a sebaceous cyst. What I have seen in my OPD over these years, that a small swelling comes on the body and people get panicked, they get scared and they just run to the doctor thinking it's cancer. That is the first thing people think about any swelling. And it's always good that if anything different happens with your body, any swelling or for a reason, any other thing which you think is not a normal, not from a suddenly has came or it's persisting for long, you should go and take an expert opinion. So this video I'm talking about a sebaceous cyst. What is sebaceous cyst? Sebaceous cyst is a small swelling which occurs on a body, any part of the body. If I tell you how it starts, a sebaceous cyst forms from a sebaceous gland. We have a oil secreting gland which is called as a sebaceous gland. That's how we tell to the people that your body is oily or not oily or dry. So this is a gland which secretes the oil. So what happens is sometimes we work in extremely hot conditions, so we sweat a lot, or we are in a dusty situation, so the pores gets blocked. Now when pores gets blocked, this gland has a very small mouth, like from the area which the oil comes out. Okay, so that gets blocked, and once it gets blocked, this oil doesn't come out, so it gets stored inside in that gland and it forms a swelling. So that swelling initially will be very small, you may not be realize also there is a swelling. Slowly over the period of days and months, this swelling starts increasing in size, and one day suddenly you will feel there is a pain in that area. That pain happens either because of the tension in the cyst is more, or it's getting infected. Once it is infected, what you will see is it will be not just painful, but there will be some color change. It will become little reddish in color, or some cases maybe little slight brownish in color. So in that condition, you will go to doctor immediately. When it is not painful, usually we avoid. We think that it will go by itself. We even don't notice it. So this cyst, how it looks like. So this cyst will be small, or sometimes it might be big also if you have ignored it for a long time. The cyst will have a small black punctum. Black punctum means the hole from which the oil comes out, it gets blocked, and there will be small black punctum on that. Punctum is dot, so you can see a small dot on that. As per my experience, not 100% of cases will be having that small dot, but yes, more than 90-95% patients will be having a small dot which will be black in color. So if you have a swelling like that, most probably it will be a sebaceous cyst, but we need to rule out the other conditions also. So any swelling needs to be properly evaluated, and it should be done by expert. So thing is, whenever you get a swelling, you should meet expert in that field. So what happens with sebaceous cyst? Now the sebaceous cyst, what we say, the oil keeps on getting accumulated inside. It becomes like a cheesy type, whitish cheesy type. Once it is infected, it becomes yellowish in color because of infection. So what will be the symptoms of it? Symptoms will be, you will see swelling in whichever part it has came. It might be from a small millimeter to centimeters. It might be like big size, maybe a size of 5 centimeter or sometimes 6-7 centimeter also. Along with that, you might see a color change over there, like a reddish color. If that means it is getting infected. So in that case, what you have to do first is meet a doctor. He might tell you that it has to be drained. Drain means the content inside is infected, it has to be taken out. Once the infected content goes out, you will feel relieved, that the pain will go off. But it doesn't stop with that. This cyst, once you drain the content out of it, it will still remain over there. So it will keep on secreting oil even after removing it. So if you don't remove it, it will keep on growing again. Like some people will do this, drain this pus from that, and after a few months again they will say that there is a swelling coming back. That is because the wall, the cyst is still over there. You need to take it out. So what we generally advise is after 3 weeks of removing that all the material from inside, you better excise it. Excises means you can go to the same doctor or surgeon and he will take it out completely. Once you take it out completely, in that place that cyst will not come. But we have multiple, like lots of sebaceous glands in every inch of our skin. So it's not like once you remove it, it is a permanent, like it will never come back in other place. Because we have multiple glands, it will come in different parts. So only thing which you can take care to avoid it will be cleaning yourself. Like if you're sweating too much, take a bath. If you're in a dusty environment, clean that area so the pores gets opened up. When other thing is you just noticed a swelling, but it's not infected, like you're not even having pain, there's no color change over there, but there is a swelling. So once you see a swelling like that and with a black punctum and your doctor diagnoses it as a sebaceous cyst, it's advisable to take it out. That time you need not open and remove the content, you can directly take out the entire cyst because it's not infected. So it's not infected, that means you can take it out completely. Once it is infected, what happens is the swelling gets adherent. Adherent means it sticks to the surrounding tissues, and we cannot, that time it will be difficult to take out the cyst completely. So if anybody is trying to take it out, some part of the wall may remain behind and it will recur. Okay, so in case of this cyst, if it is not infected, we can take it out completely at the same sitting. If it is infected, you need 2 sittings. First is draining the content, and second will be removing the cyst. And depending upon size and the area, like if it is a very small size, we can do it under local anesthesia. Local anesthesia means we'll give injection in that local area, where the cyst is surrounding that area, and once you are properly fully anesthetized, doctor will take it out. So next question comes, whether there will be stitches or not. Okay, so if it is incision and drainage, that means if you are opening and taking out the pus from it, usually keep it open. We don't put stitches in that case because the pus has to come out. Even after draining it, you have to do dressing for next maybe 5 to 7 days so that it completely drains up, and then it will start healing and it will shrink in size. In case it is not infected, when we excise the cyst, if it is small size or bigger size, usually the stitches will come accordingly. If it is clean, like no infection at all, doctor might put absorbable stitches. If doctor thinks that stitches might get infected, he might put the removable stitches. So it's all on the decision of a doctor whether to put which type of stitches. But most of the time when we remove this clean sebaceous cyst, doctor preferably puts stitches so that it heals faster and the scar will be smaller in size. Next thing about sebaceous cyst I will like to tell, that okay, the surgery is done, it's a clean sebaceous cyst and you have removed it. So now when to remove the stitches? What I prefer is if the cyst is totally clean and stitches are put over there, one dressing I advise within 5 days, so that doctor also get to know how his wound is healing or not. So you should visit a doctor. If you have any doubt, you can visit him early, or else follow the doctor's instructions. So once the dressing is done, then doctor will ask you to come for stitch removal directly, which is usually 8 to 10 days depending upon which part the cyst was. So on 8th day or 10th day, if it is other parts of the body, doctor will take out the stitches. In case of it was a infected cyst and you have drained it, so same thing, we do the dressing till it heals, like all that cyst will shrink in size. Finally you will get a small area of a scar, or small area of a scar with maybe again that small punctum might be seen over there, which you have to remove it after 2 weeks of complete healing in that area. And once you remove it second time, that time doctor will preferably put the stitches so that it heals with a very clean single incision. It will heal nicely, so that scar formation will be minimal that time. Usually the doctor might prescribe you the medicines like painkillers depending upon the pain, how much it is. The doctor will give you the painkillers for 5 days. Antibiotics, if it is infected, yes, doctor will give the antibiotics. If it is clean case, it depends on doctor whether antibiotics are required or not. and along with that, dressing that depends upon a doctor. If the doctor have its own way to follow the patients, so you need to follow the doctor's instructions properly for that. So friends, I hope you understand this topic about sebaceous cyst. If you have any doubts, you can post in the comments. Small photos I will be attaching to it so that you can get an idea how it looks. Thank you very much. See you soon.